Hi, Cole. My name's Veronica. I'll be your nurse for today. How are you feeling?
I'm good. How are you?
I'm good, thank you. So today I'm going to be assessing your nose, your mouth, and your throat. Is that okay with you?
Yeah.
Okay, perfect. So I'm going to start by giving you some privacy by closing the curtains. And I've already performed hand hygiene before I enter the room, okay? Okay, so I'm going to start by having a look at your nose, and I'm going to be assessing cranial nerve number 1, which is the olfactory nerve, okay? So here I'm looking for symmetry, and I don't see any swelling on one side. The nose is symmetrical to the face, and it looks good. So now I'm going to be using my pen light, and I'm going to have a look up your nose, if you could just tilt up. Perfect. And here I'm looking at the septum, and I'm going to see if it's deviated more to one side. And it is not. The nostrils are even, and that's good. So I'm going to ask you a few questions now. Do you have any difficulty breathing?
No.
Okay. And do you ever experience constant nosebleeds or runny noses?
No.
Have you ever had surgery or a traumatic injury on your nose?
No.
Okay, perfect. So I'm just going to start by palpating the sinuses. So I'm going to start with the maxillary. And I'm going to move into the frontal. Okay. And I don't feel any bumps. I don't feel any edema under the skin, which is good. Did it hurt at all when I was palpating?
No.
Okay, that's good. So now I'm going to ask if you can just cover one nostril and breathe through the other. And is that okay?
Mm-hmm.
Can you repeat that on the other side, please? Okay, perfect. And there's no problems with that?
No.
Okay, good. So now I'm going to move on to the mouth, and I'm going to ask you to smile for me. And again, I'm looking for symmetry, so there's no droopiness on one side, and that's good. So I'm going to ask you a few questions. So do you ever have difficulty chewing or pain when you're chewing?
No.
Do you have often irritation of your gums or bleeding when you brush?
No.
Okay. And have you ever had surgery on your teeth or your gums before?
No.
Okay, perfect. So I'm going to ask you to smile again. And again, I'm looking at his teeth. So there's no cracks in the teeth. There's no browning of the teeth. The teeth are straight and aligned. His lips are pink in color and they're moist, which is a good sign. And can you open your mouth for me, please? So here I'm having a look at his gums, and I'm assessing the color. So they are light pink. They're not red, which is a good sign because that could mean either a gum disease or an infection. And so I'm going to ask if you can raise your tongue to the roof of your mouth, please. Okay. So again, I'm assessing right behind his teeth under his tongue, and I'm assessing for color again. It is light pink. There are no lesions, which means that there's no concerns, and it is moist and is not dry. Okay, perfect. So now I'm going to assess for cranial nerve number 12, which is the hypoglossal nerve. So I'm going to ask you to stick your tongue out for me. Okay, and again, I'm assessing for symmetry and the alignment. So the alignment is straight with the mouth and straight with the face, and it is able to move. So yeah, that's good. Thank you. You can stick it back in your mouth, please. And now I'm going to move down to your throat. So again, I'm having a look at the throat, and I'm noticing that there are no bruises, there's no swelling or bumps, and there is no enlarged thyroid glands around the area. So that is a good sign. So I'm going to ask you some questions now. Do you have any difficulty swallowing?
No.
Have you ever been addressed as a medical concern for dysphagia?
No.
Okay. And do you ever often have a sore throat or a dry cough?
No.
Okay, perfect. So I'm going to ask you to open your mouth again. And this time I'm going to use a tongue blade. And I'm just going to hold the tongue down. And I'm going to ask you to say, ah.
Ah.
Perfect. And now can you cough for me? Okay. And so here I'm assessing for cranial nerve number 9 and 10, which is the hypopharyngeal and the vagus nerve. And so again, I'm looking at the uvula and the soft paddle of the mouth, and I'm going to see if it lifts and is able to move. Perfect. You can close your mouth. So that concludes today's assessment. I'm going to go document my findings. Are you okay?
Yeah, thank you.
Okay. Thank you. I'm going to go perform hand hygiene now.